The main causes of myocardial infarction are blockage of the coronary arteries, which supply blood and oxygen to the heart muscle. The blockage is usually caused by a buildup of fatty plaque and calcium in the arteries, known as atherosclerosis. Some of the main causes of atherosclerosis include high blood pressure. High blood pressure can damage artery walls and increase the risk of plaque formation. Elevated cholesterol. Elevated LDL cholesterol can build up on artery walls and form plaque. Smoking. Smoking increases the risk of atherosclerosis and myocardial infarction. Diabetes. People with diabetes have an increased risk of developing atherosclerosis and myocardial infarction. Advanced age. The risk of myocardial infarction increases with age. Family history of heart disease. Sedentary lifestyle. Obesity. It is important to understand that these risk factors can be controlled or modified through lifestyle changes such as a healthy diet, regular exercise, avoiding smoking, and keeping track of chronic diseases. Chest pain is not the only sign of a heart attack. Maybe it's the most common, but no, it's not the only one. But since we are talking about this pain, it is worth remembering that pain in the thoracic region can also radiate to other parts of the body such as shoulders, back, arms and neck, for example, which occur regardless of whether you are moving your body or not. Diabetes, hypertension, obesity, smoking, high cholesterol, family history of heart attacks and age are also factors that contribute, and a lot, to the chances of a heart attack becoming even greater. Thus, in addition to all these factors, there are other very common signs that are often considered just discomfort, but which can also indicate a heart attack. Check out some of them here. Fainting. This can be one of the first signs of heart problems. Along with shortness of breath and sudden sweating, there is a lack of oxygenation in the brain and, consequently, fainting, one of the little-known symptoms of a heart attack that deserves attention. Shortness of breath. One of the sensations is the tightness in the chest, which occurs due to the malfunction of the lungs, causing the individual to have shortness of breath. It is a sign that can appear alone or accompanied by other symptoms. Nausea, indigestion, or abdominal pain. Nausea, indigestion, and abdominal pain are often seen as simple digestive discomfort, but you need to be aware. If this nuisance is constant, the best way to understand it is with the diagnosis provided by the cardiologist. Dizziness. Low oxygenation in the brain causes the heart to beat irregularly, thus causing dizziness. Weeks before the heart attack, the body can also begin to show this sign. Cold sweat, sweating. Along with dizziness and tightness in the chest, sweating may also occur. Therefore, sudden and excessive sweating can also be a warning sign. Dry cough. It's not always a simple cough. Know that, in addition to compromising the functioning of the heart, the infarction also compromises the lungs, which can cause a dry and very uncomfortable cough. Palpitations. Along with coughing spells, palpitations occur. Arrhythmia causes the feeling that the heart is beating too fast. If palpitations are constant, it is very important, first of all, to consult a cardiologist to check if it could be a sign or if it is related to other health problems. Weakness. Usually, days before a heart attack, the individual may feel an immense feeling of weakness. She often goes unnoticed, like a deep tiredness. In women, the symptoms are different. It is common for women to experience different and not so traditional symptoms in cases of heart attacks. Stomach pains and feeling tired for no apparent reason are two of them. In addition, there is also the silent heart attack, without the classic symptoms such as chest pain and others already mentioned here. And why are they different? Women have a slightly smaller heart than men, that is, with different physiology. With a faster average heart rate and thinner coronary arteries, they are more likely to suffer from blockages in both the larger and smaller arteries. Thus, they may feel the sensation of pressure or tightness, unlike men who usually feel more intense pain and twinges. Hope you enjoyed the video. Don't forget to subscribe and tell us where you are watching the video from, and see you soon.